for hand hygiene. I'd say, hi, my name is Morgan. I'm going to be your nurse today. Today we're going to be performing a venipuncture per the doctor's orders just to get some blood if that's all right with you. Great. All right, I'm going to check name and date of birth on patient's wristband, ask them if they were in any pain. They're in no pain, great. So I'm going to get started with everything. All right. So first off, I'm going to put the tourniquet around the upper arm, making sure it's nice and snug when I tie it. And then I'm just going to assess to find a good vein to grab some blood from. Okay, once I find that, I'm going to release the tourniquet so it's not on for too long. And then I'm going to go ahead and apply my gloves. Go ahead and I'm going to clean around the vein. I'm going to go into circular motions. Okay, and then after I'm done with that, I'm going to make sure it's all clean before I start anything. So while it's drying, I'm going to set up all my equipment. First off, I'm going to go ahead and open this, put this on the tube. Okay. And I'll have all of this ready. Okay, and now since all the alcohol, everything's dry, I'm gonna go ahead and reapply this tourniquet, nice and tight. Okay, I'm gonna go ahead and take the cap off the lid. I'm gonna inspect the needle, make sure the bevel is up, and make sure everything's looking all right. And then I'm going to go ahead and I'm going to find that vein that I would like to go into. I'm going to make sure the needle is at a 15-degree angle while I am going in. Okay, and once I'm in, I'm going to keep hold of that. We're going to go ahead and put the tube in. Okay, and once I get blood, I'm going to go ahead and take off that tourniquet just so it's not on for too long. Then I'm going to continue to hold on to this and I'm going to take it out and then I'm going to snap that safety on. I'm going to hold this for about 2 to 3 minutes just until the patient stops bleeding. Once the patient stops bleeding, I am going to take some tape and I am going to put it over the piece of gauze. Alright, and then after that I'm just going to shake up the tube a little bit, make sure everything is looking good, everything's mixed if there was anything in there. And after that I would put the patient's name, date of birth, room number, and then I'd put my initials and I would go ahead and send that down to lab. And once I'm done with that, take off my gloves, clean everything up, and you're all done.